Una Coles, thank you for joining us. Now, everyone knows, anecdotally, a clean living person who unfortunately does get cancer and somebody who smokes and drinks who stays healthy the rest of their life. There is somehow an inherent unfairness, it seems, to how cancer strikes. How can that be?
It does seem like that. We can't guarantee 100% that somebody won't get cancer if they lead a healthy lifestyle, nor can we guarantee that somebody with a family history of cancer or who has risk factors will get cancer, but we can do something about it.
And it's that concept of risk, isn't it, that I suppose as a GP you find difficult to explain to people. I mean, how do you do it, say, sitting in your surgery?
Exactly. When we talk about risk, we have a picture of smiley faces, so that's 1 in 100 smiley faces or what have you, or we might talk about an airplane crash, or we might talk about crossing the road and getting hit, things like that. We try to make it practical.
Right, to try and explain about, yes, what is more and more likely to cause you problems. So, in terms of the other thing, I suppose the media are quite guilty of sometimes is throwing something out there, going, oh my goodness, this is bad for you, and you don't really know where on the scale of things it's bad for you. So if you were to say what's the first thing for people to stop doing and change their lifestyle, what would be top priority?
I would definitely say try to stop smoking. I know there are some smokers out there and they live by it and they will argue that, oh, but I know somebody who smoked all their life. But it's something that has a strong link to cancer, and if you can stop smoking, you will live longer.
Right, so for the non-smokers out there, what would the neast priority be? What's number 2 in the kind of cancer hit list, as it were?
Alcohol. Alcohol is linked to head and neck cancer. People aren't aware about that, but I've seen people as young as in their 20s getting throat cancer, well, it wasn't throat cancer, it was thyroid cancer.
Really?
So if you can drink in moderation, you absolutely don't want to get liver cancer. I mean, there are all sorts of cancers linked to alcohol that people aren't aware of, so in moderation, please.
Right. And of course, I suppose there is one other thing that as a GP you're always urging people to do, and that is to look out for the signs, as it were, because early diagnosis, it leads to the better outcomes.
Yeah, so with cancer, of course, you're going to have pain, so any unusual pain, or you may have a lump in your neck, or a lump in your breast, or lumps, unusual lumps of weight loss, any blood, so if you're vomiting blood or having blood from your back passage, so anything that's unusual, if your bowel habits change, things like that, especially if you have family history, so it's a combination.
That you need to look out for, and so do we. Okay, Una, thank you very much indeed for your advice.